A root canal treatment can be a lifesaver for a tooth that's been damaged by deep decay or infection. It's a procedure that, when done correctly, not only alleviates severe pain, but also preserves the natural tooth, preventing the need for extraction. However, like any medical treatment, the success of a root canal doesn't just depend on the procedure itself, but also on the actions you take before, during, and after the treatment. Understanding what to avoid during this critical time can make all the difference between a smooth recovery and unnecessary complications. In this guide, we'll explore the top things you should never do during a root canal treatment, helping you navigate the process with confidence and ensuring that your journey to a healthy smile is as painless as possible. It's essential to understand that the pain you experience during a root canal isn't just from the procedure itself, but often from an underlying infection deep within the tooth. While the root canal treatment works to clean out the infected tissue inside the tooth, there may still be an infection in the surrounding bone that can only be effectively treated with prescribed antibiotics and pain medications. Stopping these medications too soon can allow the infection to persist or worsen, leading to further complications and prolonged pain. Always complete the full course of medication as directed by your dentist to ensure a smooth and successful recovery. I've seen patients stop their medication as early as the second day, once the pain begins to subside. However, doing so can lead to an incomplete cure of the infection, leaving behind residual infection beyond the root apex. This can linger unnoticed and may flare up days or even months later, causing a reinfection of the same tooth and resulting in pain even after the root canal treatment has been completed. To prevent this, it's crucial to finish the full course of medication as prescribed. Root canal treatments are a meticulous process that typically requires multiple visits to the dentist. Each appointment is crucial, as it allows your dentist to thoroughly clean out the infected tissue, shape the canals, and ensure that the tooth is properly sealed to prevent future infections. However, once the initial pain subsides, many patients fall into the trap of thinking that the worst is over and that the remaining visits aren't as important. This false sense of security can lead to a dangerous decision: skipping appointments. When you skip even a single visit, you risk leaving parts of the tooth incompletely treated, giving any remaining infection a chance to take hold again. This can result in the need for additional visits, as the infection may reestablish itself within the canals, potentially leading to more severe pain, additional procedures, and even the possibility of losing the tooth altogether. Furthermore, this behavior can have financial implications. Extending the treatment timeline due to missed appointments not only prolongs the discomfort, but can also increase the overall cost of the procedure. What might have been resolved in 2 or 3 visits can turn into a drawn-out process with added expenses for additional treatments and medications. The cost of dental care can be significant, and unnecessary delays only add to that burden. To ensure that your root canal treatment is as effective and efficient as possible, it's essential to adhere strictly to the appointment schedule provided by your dentist. Completing the treatment as planned is the best way to avoid complications, additional costs, and the potential for recurring pain in the future. During a root canal treatment, the tooth being treated is particularly vulnerable. Eating hard foods on this tooth can place undue stress on it, which might lead to significant discomfort when you bite down. The tooth is already weakened from the infection and the treatment process, so introducing additional pressure can not only cause pain, but also risk further damage. This is why it's so important to stick to softer foods until your dentist confirms that the treatment is complete and the tooth has fully recovered. Moreover, the tooth undergoing a root canal is more fragile than usual, making it more susceptible to fractures. Biting into hard foods during this delicate phase could result in the tooth cracking or breaking, which could complicate your treatment. If the tooth were to break, it could extend the duration of your treatment and potentially require more extensive dental work, such as tooth extraction or even building an artificial tooth portion using post and core. To ensure a smooth recovery and avoid prolonging your treatment, it's essential to avoid hard foods, and follow your dentist's advice until the tooth is fully restored. When experiencing pain during a root canal treatment, it's natural to seek immediate relief, and many people might turn to external pain relief balms or oils, applying them to the face or the area around the affected tooth. However, this seemingly harmless remedy can actually do more harm than good. These balms and oils are not designed to treat dental issues, and their use can irritate the skin or the underlying tissues, potentially leading to facial swelling and even more severe complications. What might seem like a quick fix can end up worsening your condition, complicating the treatment, and extending your recovery time. Instead of turning to these unproven methods, it's crucial to follow your dentist's treatment plan closely. Trusting in the professional care you're receiving will ensure that your recovery is smooth and that you avoid unnecessary complications. It's not uncommon for patients to request a simple filling instead of undergoing a root canal treatment, thinking it might be a quicker or less invasive solution. However, this approach is highly inadvisable. A tooth that requires a root canal has a deep infection or damage that cannot be resolved by merely sealing the surface with a filling. If the infected or damaged tissue inside the tooth isn't properly treated, covering it with a filling only traps the infection inside, leading to severe complications. The very next day, you might experience intense pain and swelling because the underlying problem has been sealed in rather than treated. A tooth that is recommended for root canal treatment needs to undergo either the root canal procedure or, in some cases, be removed entirely. Filling it is not a viable option. Attempting to avoid a root canal by opting for a filling can result in the infection spreading, causing further destruction inside the tooth. This can lead to unbearable pain, extensive swelling, and the need for more complex and costly dental procedures in the future. It's essential to follow your dentist's advice and proceed with the recommended treatment to ensure the long-term health of your teeth. After a root canal treatment, it's crucial not to leave the tooth unprotected. A tooth that has undergone a root canal becomes inherently brittle due to the removal of its internal structure, which can lead to it breaking into small pieces over time. To prevent this, placing a crown on the treated tooth is highly recommended. A dental crown serves two vital functions. First, it protects the tooth from all directions, shielding it from potential fractures or damage that can occur during normal chewing and biting. Second, it helps distribute the forces exerted on the tooth more evenly, which preserves its remaining structure and functionality. Without a crown, the weakened tooth is at a much higher risk of breaking, leading to more complex and costly dental issues down the line. For these reasons, opting for a crown immediately after a root canal treatment is essential for ensuring the long-term health and durability of the tooth. On the other hand, placing a crown immediately after a root canal treatment may not always be the best approach. Sometimes, residual infection or complications can arise shortly after the procedure, leading to pain and discomfort. If this happens, a re-root canal treatment might be necessary before a crown can be successfully placed. Therefore, it's generally advisable to wait at least a week after completing the root canal treatment before opting for a crown. During this waiting period, the tooth should be monitored for any signs of pain or infection. If no issues arise and the tooth remains stable, then proceeding with a crown is appropriate and beneficial for long-term protection. This approach ensures that any potential complications are addressed before committing to the final restoration, ultimately preserving the health and integrity of the tooth. In conclusion, a root canal treatment is a crucial procedure for saving a damaged or infected tooth, but it requires careful attention and adherence to your dentist's advice to ensure a successful outcome. Avoiding mistakes such as stopping medication prematurely, skipping appointments, eating hard foods, using external pain relief methods, or opting for a filling instead of a root canal can make a significant difference in your recovery. Additionally, while it's essential to protect the tooth with a crown, waiting to ensure the infection has fully resolved is also important. If you found this video helpful, please consider subscribing to our channel. We've noticed that 99% of viewers who benefit from our content haven't yet subscribed. By subscribing, you'll help us reach more people who need this information, and you'll stay updated with our latest videos. Your support helps us continue to provide valuable dental advice and tips. Thanks for watching, and don't forget to hit that subscribe button.